What to expect when your child has bronchiolitis. Bronchiolitis is a common illness of the respiratory tract. It is caused by an infection of the tiny airways that lead to the lungs. Children under age 2 are more likely to get bronchiolitis than older kids or adults because their small noses and airways can become blocked more easily. If your child has bronchiolitis, they will often cough, have a runny nose, wheeze, and breathe fast, and sometimes will have a fever or gag and throw up after coughing. Many children get better from bronchiolitis at home, but if breathing or drinking fluids becomes difficult for your child, they may need to be treated at Children's Hospital Colorado. While your child is getting better here, they will probably receive extra oxygen. The oxygen can be given either through a low-flow nasal cannula or a heated high-flow nasal cannula. Your child's nurse or respiratory therapist will help clear the mucus from your child's nose with either bulb suction, wall suction with a mushroom device, or deep suction with a nasal catheter. Suction can be uncomfortable for kids, in the same way that it's uncomfortable for them to blow their noses. Your nurse and respiratory therapist will only do it as often as necessary. You'll find that it helps your little one breathe much easier. Your child will get better faster if they are getting enough fluids. If your child is dehydrated, we may need to give them fluids through an IV. A nurse will come by every hour or so to make sure that your child's IV is working properly. Asthma treatments used to be part of the standard care given to children with bronchiolitis. But research shows that these kinds of treatments don't actually help with bronchiolitis. Since bronchiolitis is caused by a virus, antibiotics don't help either. Research also shows that viral testing or chest x-rays aren't helpful in caring for a child with bronchiolitis. Because the virus that causes bronchiolitis can spread, one of the best ways we can help your child heal and protect others is to follow Droplet Precautions. This means that doctors, nurses, and staff will all wear yellow gowns, gloves, and masks when they enter your child's room. If you see anyone forget to do this, please remind them. Using Droplet Precautions means your child can't leave his or her room. Ask your nurse about bringing in toys, movies, or games to keep your child busy and happy. Or you can ask for a child life specialist. They have special training in using play and recreation to make your child's hospital stay easier for your entire family. There's a lot you can do to help your child while they're here. Help our team keep your child calm and entertained so that they can get used to the nasal cannula. Once your providers say that it's safe for your child to eat and drink, help them stay hydrated by frequently offering them formula, breast milk, or clear liquids. If your child can walk or crawl and they're feeling better, help them be active. Moving around their room will help your child's lungs stay open. Your nurse can help you get longer oxygen tubing or a play mat for the room to make moving around easier. You can also learn how to suction your child properly. Your nurse can teach you how to do this. It's easy and will help you when you get home. The most important thing you can do during your child's hospital stay is to tell your nurse or medical team if you notice any change in your child's breathing or behavior. Children with bronchiolitis usually stay in the hospital for 2 to 4 days. When your child is drinking and eating well, breathing comfortably off oxygen, and is able to clear mucus away with only the bulb suction, they are ready to go home. If your child is feeling better, but still needs a small amount of oxygen, we may be able to send them home with a nasal cannula oxygen setup that you can manage. This can be a little tricky, and your child will still need to have a checkup with a doctor 2 to 3 days after leaving the hospital. Be sure to talk with your medical team if you want to know more about this option. At Children's Hospital Colorado, we are committed to safe, evidence-based care for children with bronchiolitis.